The cardiovascular program in Catholic Health is really one of the top programs in the region. We have great outcomes and take care of the patients in a great manner. Early medical responders, EMTs, firemen should realize that there really is great care at Mercy Hospital. There's great cardiovascular care. The EMTs are an integral part of the first response for patients having heart attacks. And it's very important that they understand that we at Mercy Hospital provide great rapid response and have great outcomes. It's important for people in the community and first responders such as EMTs to recognize that patients get faster care and great care if they're brought to a STEMI receiving center first rather than to an outlying community hospital. This way we know the patient is coming and we can get ready for them in an expeditious manner. EMTs bringing patients to Mercy Hospital should expect to be greeted by the physician and staff. We do want their input. We want to understand what happened in the field and what transpired in their care of the patient in the field. Within Catholic Health and at Mercy Hospital, our team is dedicated to responding and being within the hospital 24/7 within 30 minutes of our call for response for heart attacks. The surgical team is on call to back up the cardiologists in the event of an emergency. The cardiologists have a team that rotate so that someone is available to respond to any cardiac emergency. Mercy Hospital is well equipped to care for any cardiac emergency. We have a state-of-the-art emergency room, 7 brand new interventional cardiac labs that can provide care for cardiac emergencies, stroke, and electrophysiologic emergencies, pacemaker implantation. All labs are capable of performing emergency surgery right within the lab should an emergency arise. It's a team concept. There are nurses, technicians, physicians on call 24/7, and the first responders are extremely important in getting the patient to us in a rapid manner. We shouldn't forget the people who are the first responders.
Our goal is to get you into a primary stroke center as quickly as possible because we know time is brain. And with each passing minute, more and more central nervous cells die. So if we can get you scanned and give you intravenous TPA and then make the decision to transfer you to a comprehensive center, that is your best chance for limiting cell death in the brain. As an EMT, it's in your patient's best interest to go to a hospital that has all the services that you could possibly provide for a stroke patient. And if time is brain and you're driving by a facility that offers only the finest care available in Western New York, then you're doing your patient a disservice. If an emergency medical team drove by a Joint Commission approved stroke center, especially a comprehensive center, and the patient had a bad outcome, it's possible that the delay could be responsible for the patient's demise. All the hospitals in the Catholic health system have a direct link to Mercy South Buffalo so that patients can be transferred quickly and efficiently as needed and be cared for by the stroke professionals like fellowship-trained stroke neurology, fellowship-trained critical care, fellowship-trained neurosurgeons, as well as catheter-based neurosurgeons and neurologists so that the patient gets a continuum of care from the minute they're seen to the minute they're discharged. The EMT would arrive at our triage bay. Patients would be seen immediately. They would be cleared to have a CT scan of the head. They would be rushed to the CT scanner. We do very sophisticated imaging with our brand new CT imaging, and it enables us to see which part of the brain is at risk and which part of the brain may be beyond treatment. And we make our triage decisions to open up blood vessels based on CT imaging. We then sometimes give TPA at the discretion of the fellowship-trained stroke neurologist, and then if the neurologist feels that it's a severe stroke, we may layer on top of that catheter-based techniques to grab the clots out of the brain. We have special equipment that enables us using X-ray angiography to grab clots out of blocked blood vessels in the brain. So the equipment you see behind me enables us to go through a small puncture in the leg and snake a 1 millimeter tube up directly into the blood vessels that feed the brain that may be occluded, and then we have many devices that enable us to pull the clots out, reopen the blood vessels and establish flow, and in many cases this results in improved outcomes, and in some cases even reverses the stroke symptoms completely. Alternatively, if you come in with a blood vessel that has ruptured and there's bleeding in the brain, this equipment enables us to close off the abnormal parts of the blood vessels that are bleeding and negate or obviate the need to take the patient to the operating room and open their head surgically to fix the broken blood vessel. We have nurses throughout the stroke center that are specially trained to care for patients in their perioperative period, and what we've seen is outcomes have improved across the board as a result of the rigor required to become a comprehensive stroke center.